Hello, today we'll look at which levels of neutrophil count is important when we deal with clozapine treatment for treatment-resistant schizophrenia. This means we have a patient with schizophrenia, we have tried other antipsychotics, they didn't work, so we tried clozapine, which is our best tool, so best medication against patients who are resistant to other antipsychotics. And then before we start clozapine, we need to have a neutrophil count. And the neutrophil count is our police force, our immune system of the body. And we have to have more than 1,500 cells per microliter of neutrophils in order to start clozapine. Okay, let's see now. We have a patient who has more than 1,500. So let's say 2,000. We start with clozapine. The side effect of clozapine can be that it reduces the neutrophils. And now we reduce the neutrophils, let's say, with this clozapine treatment. We have started giving the patient clozapine, and now we have a level between 1,500 and 1,000. So 1,000 to 1,500. That means that we are below the level that is required to give clozapine. We are below 1,500, but during the treatment. So before the treatment, we was above 1,500. During the treatment, we are now below 1,500. And we are between 1,000 and 1,500. What do we do now? Do we stop the treatment? Do we continue it? What do we do? We have a schizophrenic patient. We want the best for him. Of course, we could stop the treatment now. But if the level will be 1,200, 1,300. It will be in the span of 1,000 to 1,500. It will be stable like that. It will not drop more. Then we don't stop the treatment. Then we continue the treatment. What we do instead is that we regularly monitor the level by taking a blood sample from the patient regularly. In the beginning, we take a blood sample three times a week. So very regularly. We don't stop clozapine. And if we see after a while that, yeah, this is working, okay, the level is stable, we can prolong the monitoring a little bit. So we'll maybe prolong every 2 weeks. And then we see that it's stable. Then we prolong it 1 month. And then we prolong it and so on. And we see that it's stable, we continue that. But what happens if it drops less than 1,000? So now we are between 500 and 1,000. Then we need to stop the medication. And we don't need to stop it for life. We just stop it. And we wait until it reaches above 1,000. When we see it reaches above 1,000, we start it again. And then we continuously make the monitoring. Blood sample, check the level of neutrophils, and so on. What happens if it drops less than 500? Then we need to stop it. We stop the medication. We don't wait until 1,000 and so on. We now make a consultation with a hematologist. So this is a specialist, a doctor specializing in blood diseases. He will look at the case, and case by case, and of course with the psychiatrists and hematologists, case by case, we need to decide whether we should continue with clozapine or not, for how long we should stop the medication, and so on. Because maybe the patient is having schizophrenia with suicidal thoughts, harming somebody, harming himself, harming all the people around him, having this bad psychosis, very severe side effects. We need to talk with the hematologist. And if the benefits of clozapine outweigh the risk of having a very low neutrophil count, then we give clozapine at the lowest possible dose that we can give. At the lowest possible dose that would reduce the schizophrenic symptoms, but we would not cause a very serious drop of neutrophils. So once again, we have a patient, we want to give clozapine. Why? Because the patient is having a treatment resistance, meaning we tried antipsychotics and they didn't work. We now try clozapine, but before we do that, we check the blood level of neutrophils. Neutrophils are more than 1,500, then we start clozapine. If it's less than 1,500, then we don't start clozapine. There can be cases, as we said, if the patient is very harmful, then as said previously, with hematologists, with psychiatrists, and then we can decide that, okay, maybe we'll start clozapine anyway. But you, as a usual guide, don't stop clozapine if it's less than 1,500. Monitor the patient very closely in the beginning, 3 times weekly, then weekly, and so on. And then you can prolong the time of the blood samples more and more with time. If the patient was now given the clozapine, we are above 1,500 level, and it suddenly drops during the treatment to 1,000 and 1,500 in between this, then we continue clozapine, but we monitor the patient 3 times weekly. If it drops between 500 and 1,000, then we stop the medication, we stop clozapine until it reaches 1,000 again, and then we can continue the treatment. If it drops more than 500 or less than 500, then we stop the medication, we see that the level increases again, we consult the hematologist and so on, and then we can decide whether the benefits outweigh the risks, and then we continue clozapine in this case. So I thank you very much for listening and have a nice day. Bye bye.